Hello everyone, I'm Dr. Santoshi Nandigam, Consultant Obstetrician and Gynecologist in Cadence Hospitals, Kodambakkam, Chennai. Welcome to my YouTube channel. இந்த வீடியோல நம்ம பிரெக்னன்சில எடுக்க வேண்டிய வேக்சின்ஸ் என்னன்னு சொல்லி தெரிஞ்சுக்க போறோம். வேக்சின் அப்படின்னா என்ன? Vaccines are basically injectables or oral preparations which are given at specified times. So அது கொடுத்துட்டுக்கு அப்புறம் நம்ம பாடி வந்து அந்த வேக்சின் ரெகக்னைஸ் பண்ணி அந்த ஆர்கனிசம் ஆர் வாட் எவர் இஸ் த ப்ரிப்பரேஷன் இந்த வேக்சின் அது ரெகக்னைஸ் பண்ணி அந்த பர்டிகுலர் டிசீஸ்க்கு வந்து கண்டிஷனுக்கு வந்து ஆன்டிபாடிஸ் ப்ரொடியூஸ் பண்ணுவோம். So our body understands that the vaccine is something which is foreign and it needs to react against it. So we tend to develop antibodies or immunity against that particular disease for which vaccination is given. So there are different types of vaccines and I've made a very detailed video on the type of vaccines, their safety in pregnancy, and I'm going to link that video in the comment box below. Going forward, the vaccines that are absolutely essential in pregnancy, I would say there are two vaccines which are very essential. Number one is the TDAP. It's called Tetanus, Diphtheria, Cellular Pertussis Vaccine. Well, it's a subunit vaccine. Appadina, it gives protection against these three conditions. One is tetanus, diphtheria, and cellular pertussis. ஏன் வந்து ஸ்பெசிஃபிக்காக நம்ம இந்த கண்டிஷன்ஸ்க்கு இந்த வேக்சின் ப்ரெக்னென்ட் மதர்ஸ்க்கு கொடுக்குறோம் அப்படின்னு நீங்கள் கேட்டிங்கன்னா we'll come to it. So the ideal time to give a TDAP vaccine is any time between 27 to 36 weeks. Although if you have forgotten it to give it between these intervals, you can always give it any time after the second trimester. The preferred is this 27 to 36 weeks. Well, எதுக்கு நம்ம இது கொடுக்கணும்னா tetanus, diphtheria and cellular pertussis are the three conditions which the baby is extremely susceptible to immediately after birth. So when we give this TDAP vaccine to the mother develops antibodies against all these three conditions, and in the antibodies வந்து placenta valiya babyக்கு reach ஆகும். So by the time the baby is born, the baby has certain level of antibodies to give protection against these three conditions. After the birth of the baby, there are different vaccinations which are given to the baby, right? The DTP vaccine, which is a protection against the diphtheria, tetanus and cellular pertussis, the first dose of it is given only at around 8 weeks. So birth landa 8 weeks varaku protection vanda is given by the antibodies which are passed from the mother to the baby through the placenta. So if we have not given this TDAP vaccine in pregnancy, the baby would naturally not have any antibodies and is susceptible to catching up these infections. So எதுக்கு இந்த infections stress பண்ணி சொல்றோம்னா, pertussis is a common condition which is prevalent in many developing countries. And babies who are exposed to pertussis can get really serious. Sometimes they can have that whooping cough. It's called as a whooping cough. It's a very deadly condition and sometimes we might even lose the baby to that condition. So by giving a vaccination, we are actually doing a lot of good to the baby, giving those antibodies and protecting the baby. Well, the second vaccination that is very important for mothers who are pregnant during the flu season is influenza vaccine. So influenza vaccine is an inactivated vaccine. It is safe in pregnancy. And yeah, doctor, influenza vaccine கொடுக்கணும், சும்மா அது flu தானே, common cold தானே, வரும் போகும், அந்த மாதிரி கிடையாது. You know, flu in pregnancy can get really serious. It's just not as simple as a sore throat or a common cold or a headache. It can get very worse. So some women can develop breathing difficulties. Some women can require a hospital admission. Some women can require something to prevent their wheeze. Some women also tend to develop a lot of fluid in their lungs, infection in their lungs called as a pneumonia. So flu it can be a simple common cold or it can aggravate to these serious conditions. And seriously, trust me, pregnancy la flu irukkaroda irritating situation onno irukadu. Imagine a big belly and then you have this sore throat, you have cough, you're admitted in the hospitals, it's not required at all. So the vaccine is very safe, and it is suggested for all the pregnant women becoming pregnant or in pregnancy anytime in after second trimester during the flu season. So these are the two vaccines which every pregnant woman should consider. And if you've not vaccinated for COVID-19, yes, COVID-19 vaccination is also extremely safe, and you should take it in pregnancy if you've not vaccinated before. So if you like my videos and the content, please subscribe to my YouTube channel. Thank you so much.